Hey guys, happy Friday. I hope everybody's having a good Friday so far. The weekend will be here before we know it. I wanted to just come on here today and I was thinking about, gosh, what do I want to talk about? And I thought just because I've gotten so many requests from people about how confusing it is, like which diet is the best and why doesn't my healthcare provider talk to me more about a plant-based diet? And so I just wanted to, talk about maybe some of the reasons why there's not more support in the medical community for recommending a whole food plant-based diet. It is, by the way, only a plant-based diet has been proven to reverse heart disease, and which is, by the way, the number one killer of men and women around the world. And so if that's all it could do, and it's not, but if it's all it could do, a whole food plant-based diet was to reverse the number one killer of men and women, heart disease, shouldn't that be the default recommendation from every healthcare provider out there? It's astounding to me that more don't know that, or they just don't recommend it. And so I did a little digging. I wanted to kind of find out what the primary reasons were for this, because really everybody should be, especially every cardiologist should be recommending a whole food plant-based diet because it's the only one that's been proven to reverse heart disease. And so I did a little digging, and interestingly enough, they did a study on this and asked physicians why they didn't recommend it. And the number one reason was that their perception that their patients fear of being deprived of all the junk they're eating. and so they were afraid to even really, I guess, talk about it. Can you imagine a doctor saying, well, I don't want to tell them to stop smoking because I know how much they like it, right? I mean, that's crazy, right? So, anyway, that's one reason. A second reason is certainly lack of time. And I am a healthcare provider, so I understand that. I know there's most providers have roughly 15 to 20 minutes with their patients, and that's hardly enough to really cover the primary reason they're there, much much less a specific lifestyle recommendation. And nutrition, lifestyle counseling, it takes time. It takes a while to go through the recommendations, and simply advising patients to eat healthy, that doesn't work, right? Because people don't know what healthy means. They don't know what that means. Sometimes they will say things like just do everything in moderation. But what is moderation? People don't know what that is either. So people need more education, and so patients really understand what their disease is if they have one, and understand why it's important to change their diet and change their attitudes around it. So lack of time is certainly a big one that I understand as a healthcare provider, but I have some in my practice. If I have someone that we're talking about their diet and lifestyle, I have a quick packet that I can just hand to them. I mean, and that at minimum shows some evidence, gives them actual resources to put their hands on. So that is something that would be great if more healthcare providers could do that. But that is also one of the reasons that I offer one-on-one coaching too. For those that need some additional support and accountability, I offer private coaching for people as well outside of my regular practice. So of course, number one reason was the perception of patients. Number two was lack of time. A third reason is lack of training. Most medical doctors and even nurse practitioners receive little to no education on nutrition and prevention. Most of what they learn are about rare vitamin deficiencies, things like scurvy and rickets and that sort of thing, which we just don't see here in the United States, at least, thankfully. But they just haven't been trained, frankly, as far as to what the best diet is. That's one of the reasons I myself have had to go out and find the research. They're not being catered by pharmaceutical companies, right? And you're not getting the research delivered to your desk, and they're busy. And so unless they're empowering themselves to read the research and find out the information, most medical doctors are not doing that. So so a lot of times they're just not out there getting the training. It's not in medical schools. I am happy to say that I think a lot of medical schools are moving towards more nutrition training as they're really diving into some of the evidence, and some of the plant-based leaders like Dr. Barnard and Dr. Greger and Dr. Ornish are really advocating for change in medical schools and NP schools. But it's something that definitely, and Dr. Clapper, he's doing a lot of work around that too. If you want to look him up as well, he's going to medical schools and talking specifically about changing the curriculums. And so there is some change happening, but most of the physicians that are out there practicing right now got very little nutrition training, so they have to find it themselves. And then the last one, of course, is economic interests. We certainly need a shift away from corporate funded, industry tailored recommendations, right? So if you think about it, pharmaceutical companies, they certainly fund most of the research on pharmaceutical drugs. And of course, that's giving them a pill, right? And of course, pharmaceutical companies, they want you to take their medications every day, once or twice a day for the rest of your life. And so that's where the research is. And so that's where what is being practiced. Of course, that's a lot simpler than talking to patients about completely changing their lifestyle and their diet to reverse or prevent disease. And so, it's certainly more demanding. And so that's another reason that I think medical providers are not necessarily recommending it to their patients. So for all of those reasons, that's one of the reasons that I like to talk to you guys like this. I like to offer private coaching and nutrition training and put information out there. And I just encourage everybody to do their own research too, and look at the evidence if you can. And certainly, there's a lot of really great plant-based providers out there. But I recommend you just empower yourself. That's why it's more important now than ever that we follow the evidence and practice a whole food plant-based diet, and really hopefully reverse and prevent a lot of the diseases that plague our country as it is. Have a great weekend, everybody. It's great. Thank you for coming on, and we will be seeing you soon.